So hello, this is Rafael Sanchez-Salas, and it is my pleasure to speak about the urologic perspective on the clinical utility and emerging data on micro-ultrasound and the exciting upcoming Optimum trial. So on the uselessness of micro-ultrasound, it has been said about the screening. There's a registry that is stating there is a superiority of micro-ultrasound compared to multiparametric MRI. When we look at biopsy guidance, there's two case scenarios. There's without multiparametric MRI, in which we have data showing there is an equivalence to multiparametric fusion when compared to micro-ultrasound. And there is the case scenario of the combination of multiparametric MRI and micro-ultrasound, in which we have seen an added benefit of 6% for the diagnosis of clinically significant prostate cancer. But there is emerging data. And this is regarding the Pyrus Tree, the controversial relations of the findings of multiparametric MRI and a local staging. So there's this systematic review from Santolidis published in the Journal of Urology. That is, when you look at the first plot, evaluating full test, registry, and conference subjects, we see this a very balanced forest plot with a micro-ultrasound guided biopsy providing comparable detection to the detection rates that we observe with multiparametric MRI guided biopsies, with detection ratios that are quite adequate for Gleason 3+4 or higher, 4+3 or higher, and obviously Gleason 3+3. Regarding the risk stratification of these equivocal lesions, the Pyrus Tree patients, there's an interesting study showing 111 consecutive patients with Pyrus Tree findings, and the deployment of micro-ultrasound could have avoided a biopsy in 23% of these cases. With the interesting part is that without the risk of missing clinically significant prostate cancer detection. So based on the Pyrus score, we are able to clear the risk stratification of those equivocal lesions on multiparametric MRI. For local staging, there is an interesting study from Regis. They proposed a protocol assessing the risk of extraprostatic extension based on micro-ultrasound. And they tested 54 patients they obtained a correlation with the final pathology. These patients were undergoing radical prostatectomy. You see there's a high sensitivity over 85% sensitivity with a negative predictive value that is close to 90%. This compares very well to the actual evaluations that we could do with multiparametric MRI in terms of local staging. One of the limitations we had in the past with micro-ultrasound with the anterior sound imaging, and this has been overcome with a new platform, which is providing the same fine images we had in the dorsolateral part of the prostate, in the anterior part of the prostate. And this is combined with the update of the Pyrus score to provide us with the perfect information in terms of the risk stratification in this part of the prostate. So there's open questions on micro-ultrasound. In the prostate biopsy arena, we have the micro-ultrasound. Can we do it alone without the multiparametric MRI? A second question would be, is the fusion performed with micro-ultrasound equivalent to those fusions, the results for those fusion devices that are more complex? And there's other areas of urological oncology. We have the usefulness and eventual benefits of micro-ultrasound for active surveillance, for focal therapy in terms of patient selection, planning, and treatment guidance, and in the future, the usefulness for bladder cancer staging as well. One exciting part is the Optimum trial, is the optimization of prostate biopsy, or micro-ultrasound versus multiparametric MRI. This is an international 3-arm randomized controlled trial, and including 1,200 subjects, and there is one arm, a micro-ultrasound only biopsy, versus a micro-ultrasound fusion biopsy with multiparametric MRI. This is a very interesting arm because it will blind and unblind multiparametric information to make a comprehensive evaluation of the prostatic performance. And there's a third arm that is featuring multiparametric MRI biopsy with conventional fusion systems. All of the 3 arms will have systematic samples as well, and this is supposed to start in the winter of this year. So in summary, micro-ultrasound shows a clear utility, both in addition to multiparametric MRI and obviously, as well as a unique assessment for prostate cancer. It is very important to keep in mind the multiparametric MRI is not necessarily available everywhere. For prostate side, there's no longer a limitation for micro-ultrasound. We have found the possibility of providing excellent anterior image quality with an updated Pyrus protocol to provide adequate risk certification. And we have the optimum trial that is aiming to provide a high-level evidence to show an ideal prostate biopsy protocol. Thank you very much.